I've been looking for a therapist and been doing some research, finding that there are a lot of different types of therapy. That's the topic of today's interview with Dr. David Day, a licensed clinical psychologist, an established therapist, and a well known clinician, teacher, speaker, and facilitator of seminars, workshops, and retreats. He's enjoyed a successful practice in the San Francisco Bay Area for over 40 years. So, Dr. Day, after my research, I'm just not sure what's best for me. Can you shed some light on this for me?
Well, indeed a lot of approaches to therapy available there, and people are getting more and more sophisticated about their understanding of different approaches. So something that comes to mind, for example, that I more frequently am asked when people start therapy with me. Anxiety is very common. It's we kind of think of it as the common cold of psychological problems, and sooner or later everybody gets anxiety and depression too, for that matter. So when people are coming to therapy, they've often done some research on the internet, and there's a lot of great resources there. In fact, many times people can get introduced to psychological tools online and some self study and that kind of thing. So I'm asked sometimes, for example, with respect to anxiety, that I've read that cognitive behavioral therapy is a good type of therapy for anxiety. Is that true? And it is. It's one of the two most effective approaches to anxiety that we have learned, and by now we have just a mountain of psychological studies that have proven that to be an effective tool, if not the effective tool. Um, so in many ways, the getting in front of a therapist and asking that kind of question is the right way to go about it. And sometimes people will hear about approaches to to a problem they're dealing with, and they've come across a particular type of therapy, and it isn't the right approach to their problem.
Huh.
So it's a good idea to ask a therapist that. And cognitive behavioral therapy, as an example, is something that almost every therapist is trained to provide. Although there are people that specialize in it.
Now, are there types of therapy that people may know about that you would recommend against that are simply not very effective based upon your experience?
If they're legitimate approaches to therapy, by that I mean where there's evidence in the form of studies and data that have proven those approaches to be effective. Um, Many times it is a good choice. The 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 in this day and age, just about everything, if not everything, that therapists are doing is evidence based approaches. So I mentioned cognitive behavioral therapy earlier. Another solid approach to psychological problems, and I would say especially problems with mood, like anxiety and depression, is something called mindfulness. A lot of people have studied mindfulness. There's been a lot of information that's been offered in business context, um, and mindfulness is a very approachable kind of response to psychological issues like stress or anxiety.
Now,
Uh,
can you read a book on mindfulness, which I have, and can that be of help to a client, or is that something that gets in the way of your work with them as a professional?
well, there are some more fringy kinds of approaches to mindfulness, but by and large, yes, you can read a book on about mindfulness. There, some of them are very practical, and they walk you through the process of learning how to do a mindful process of meditation. And so, no, I encourage people to do their own study, and even in tandem with seeing a therapist. It When you're doing your own self study, it frankly shortens up the process of therapy. And I would just as soon, sometimes I joke with my clients that I would like to work myself out of a job as soon as I can,
Yeah, yeah,
because it makes me look good, and then you'll tell your friends about me.
yeah.
Um, so yes, when people are working on their own in between sessions and studying, then they get further. Here's another good example. There's a renowned expert on marriage. In fact, he has developed a whole school of marital therapy based on his research. And his name is John Gottman. And many people have come across John Gottman. He and his wife Julie um, write books together. They do retreats, and there's free videos you can get on YouTube. And I encourage people to seek out his materials. As you frankly cannot go wrong. He's such a competent researcher, and on top of that, he's very engaging, and he's a great speaker. He's funny. You wouldn't think a researcher would be funny, but he has a good sense of humor, and his books are so relatable. He's managed to translate a lot of complex data into some very useful principles. So if someone brings that up, if they ask me, are you trained in the Gottman approach? I'll say, well, no, I'm not certified, but I have taken courses from him. I'm familiar with his material, so we can make that a part of our work together. But if someone knows about Gottman, by all means, I would encourage them to read one of his books, any of his books.
Do most of the people who come and talk to you, have they done this kind of research to try to figure out on their own what to do? Or do most people come just cold turkey and contact you and they've got problems and start from there?
It varies, I would say. I would say in the last decade or so, people are more informed psychologically, and they have done more of their own study. But it also depends on people's personalities, and some people are just not interested in self-help. I would say that many of the people of the male persuasion are not so interested in self-help reading, and their spouses or partners are trying to get them to read self-help books, and they don't like to. So that's
Doesn't work very well. And if they don't want to, it's not going to happen.
no. More and more so, I would say men and women have read a lot or researched and tried things, and there's so much information, so much good information out there on the internet.
Well, if you're watching this and you are interested in talking to Dr. David Day, the information is across the bottom of the screen, and you can reach him on his website, or you can call him directly at his cell phone number. So thank you so much. Very interesting conversation, uncovering some of the mystery of therapy. So thank you.
Well, good to be with you, Stan.
Good to be with you.